nurses within surgery centers and hospitals. It's like they see everybody's work.
Yes.
So if they see everybody's work and they choose you, you're like, okay, well, then you're really trusting me to do this for you.
Staff getting surgery. Like, is that common in your practice? And like, are surgeons operating on your own staff? And does that become, like, are they willing to share that? Is there a requirement in your office? Because I've heard different things from other practices. We have our own kind of policies, but what do you guys do in your practice?
Yeah, it's certainly not a requirement for us. It's if somebody is, when you're working in that industry, right? It's like you see all these things happening. You're like, well, I want that. That looks great. I would also like that. So we have it set up where we have discounts if somebody who's working there wants to have something done and they can enjoy that. And honestly, I don't operate on a lot of people who are currently in the office. It's after they move on to like another position. Cause like MAs and front desk staff, they're all, you're a stop off on their way, their journey to whatever they're doing, medical school, nursing, whatever they're going to do. But after they leave is when they come back. They're like, okay, now it's time for the breast talk. Now it's time for a lift. Now it's time for the tummy tuck. So we see a lot of that. I was actually kind of surprised by that. And it's intimidating because you know them very closely. You're like, oh my God, it's like, this is what I do for a living, but you only want you want the best for everybody, but totally. You know them so personally. Yeah. You're like, thank you so much for the trust, but it's lightly terrifying. Yeah. Thankfully, it's like things go well. They're excited and happy. Yeah.
Yeah. We kind of have both. We have patients obviously that are our staff that still work there, but then like you said, others that have left and then come back. Actually, someone today I saw was a similar situation, has moved on or, gone on other things in life, but it's cool to see them again. And yeah, I agree. I think, to require any patient, whether that's staff or, some surgeons now are trading surgery with influencers so that they advertise them, on social media. And I don't, the ethics of that, I don't know. It seems a little off to me, but we could talk about that later. Yeah, I agree. So there's that as well, right? So to ever require or make someone talk about the surgery you did, and because what if they're like not happy with it? You do everything and they're like happy, but now they like have to act like they're happy. If they're really not, and just because you gave them a discount, there's like all these things around it when it comes to that. But I think staff, like they are, like you said, they're like one of your best, like I think sellers of your work, though. Because they'll be honest to patients and they'll be like, hey. I had one of our coordinators, she had a blepharoplasty done and she like raved about it, and people can see it. They can tell she looks good and she's happy with it. So I think there's just benefit in that. But again, I think the line of like making people do it is, and I know people have done that. So,
yeah, I think another one who it's a good type of patient to have. It's like nurses within surgery centers and hospitals. Mm-hmm. It's like they see everybody's work.
Yes.
So if they see everybody's work and they choose you, you're like, okay, well, then you're really trusting me to do this for you. They will just rant and rave to like all the other nurses. And then you see like one nurse from one hospital. And then I see like 3 nurses from the same hospital. They're obviously like standing around the nurses station kind of talking about things. So it's always good when you see nurses come in. You're like, okay, I'm doing something right.
For sure. Yeah, that's awesome, dude. I think, like you said, of all people, they see all the surgeons, they're going to sit and compare and look and see how the patients, I think a big thing are recovery nurses. So not only just, because circulating nurses help in the OR, they can see while you're doing the case, they can see how your cases progress, if you're struggling, all that stuff. But the recovery nurse,
and on-table results.
Yeah.
They that too.
Totally. Yeah. And then, and then the recovery nurses though, they're like seeing these patients waking up from surgery. They're, they're inspecting things, like I said, kind of pretty much on table. But also like their pain afterwards, and because they'll see differences in pain even immediately post-op in different surgeons. And that's interesting to me that they can notice that, So, I don't know. Like I never really thought like you could have that level of difference. Like let's say I do a tummy tuck, you do a tummy tuck, another surgeon, like different levels of pain from the same surgery.
Absolutely.
Right?
Oh my God. Yeah. I know it's unbelievable.
Yeah.
Yeah. I remember in residency, you'd have some surgeons, you look at their post-op patients and they'd be like heavily narked up for weeks. They said they couldn't move for the first 3 days. And then you have other people who are up and about and it wasn't a big deal.
Yeah.
And a lot of that just comes from using the right local and doing it the way that it kind of should be done.
Totally. And I think even, there's a lot of really good information out there and data about, prepping patients even before they have the surgery, the ERS protocols and things to really get patients prepped in terms of pain control and management. So even starting medications before they have surgery, that morning or whatever it is before. I think those things are all super beneficial. And I think overall, this is like a guest experience in a way. They're patients, but it's like when you go to Disneyland, it's like the minute you walk in the park, even before that, but the minute you buy your ticket, right? Like that experience, then when you get to the park and then when you're in the park, it's all an experience you have. And I think for patients, it's very similar, from the minute they meet you to their pre-op to the day they show up at the surgery center, surgery and after, it's just this experience. And I think it's a summation of all those things that then they're gonna be like, hey, that was a good experience. I'm gonna refer them,